As you can see, there's a huge problems here. In the worst scenario, we can have even fractures of the titanium framework. So our challenge was to replace the titanium infrastructures, very rigid, by PEEK infrastructures, and with the resilience that the PEEK material has, to see if we can absorb some of the loads that are causing damage to the crowns and to the veneering materials. This is a case to extract the remaining teeth and plan the implant. This is an example of the CAD design for this case. We had them milled. They are milled from PEEK discs. These will be now veneered with acrylic teeth and with pink acrylic, exactly like we were doing with the titanium bars, but instead of titanium, now we have PEEK. 37 patients, which meant 49 prostheses. Two essential outcomes. The primary was the prosthetic survival, meaning that we went to see if all the prostheses had survived or if some had to be replaced. And also extremely important, the secondary outcome measures, in which we did check the implant survival. It's something that we really enjoy to see, because the bone is responding really well to this type of material. Regarding the patient's satisfaction, their opinion has been extremely good. And here we have the case finished with a very happy patient.
So how could PEEK potentially contribute to the maintenance of these excellent long-term results, basically preventing the incidence of peri-implant pathology? Marginal bone loss. The median value we found was 0.34 millimeters, which, considering the thousands of cases we have on all-on-4s, it's something that is a really good result of what we are used to see, below average, clearly. But this implicated no peri-implant pathology. It will impact here. We're talking about 6 to 8 points of prevention here. It's a lot of points. For us, translates as a good prognosis for the long term. Considering the different anatomical situations going on between teeth and implants, maybe PEEK could be the next periodontal ligament.
In the last year, the interest for frameworks made of polymer is increasing. These 5 years with PEEK material, the bone improved. Nearly something impossible happened, that we have a better bone than before, especially in the tilted posterior implants. And we compare the situation from 2008 and 2016. We see we have really healthy tissue. We maintain the bone. In 2 cases, we replaced a ceramic fused to metal restoration with PEEK because we had implant loss. We had fractures of the ceramics, and it was really a nightmare. And now these patients are stable with the PEEK framework, and they are really happy. The result was that the patients with these PEEK frameworks were extremely satisfied. And we had a score of 9.4, and that's superior to what we normally see in these studies. The message is that you can't launch new ideas on old thinking. We started in 2008 with PEEK because we started in 2006 with zirconia implants, and our mind was open for a metal-free treatment approach. So now we see that PEEK is the best material on titanium implants too. Thank you.